You know, there are numerous questions surrounding breast cancer, such like when should you be concerned with breast pain, or are you at high risk for cancer? In today's Women's Care Wednesday, Carrie Swindle from Women's Care Florida is here to answer these questions and plenty more. Welcome, Carrie. How are you?
I'm great. How are you?
I am well. Such an important topic to talk about, so I'm really glad that you're here today. And of course, you've got some exciting news in a new facility. Let's talk a little bit about this clinic and what services you do offer.
Yeah, it's really great. We have our new office, and it's got our imaging center, and then we're kind of right down the hall. So the great part about that is women can come in, get their imaging done, and see us same day. And if any other procedures need to be done, biopsies or anything like that, we can do that all in one day, all in one place, kind of one-stop shop, which is really great.
Oh, that is so nice, because already you're dealing with things that you don't want to deal with, but to make it easy, I'm sure that's very appreciated.
Yeah, people are always telling us, you know, how anxious they feel in the time between when they get their mammogram and then the week later when they finally get their results. So this is get their mammogram done, get their results same day.
And I think we need to point out, and there might be some misconceptions, this facility is for people who have not been diagnosed yet. It's not just for breast cancer patients, correct?
Correct. So a lot of what we do is treating breast cancer patients, but we also see a lot of patients who are needing to come in for follow-ups. So something was found on the mammogram, but not necessarily a cancer, just something that needs to be watched a little bit more closely. And then we also run a high-risk screening clinic for patients that are at a little bit higher risk of developing breast cancer than the average woman.
Well, you know, I'm going to ask, what does that mean? What is high risk? When people hear that term, let's kind of break it down.
Sure. So people that have anyone in their family with a history of breast cancer, that elevates their risk. And we use these validated online prediction models to estimate exactly what that risk is. And depending on how many family members have breast cancer and also their personal history, whether they've had breast biopsies in the past, how early they started having children, different things all factor into that calculation. And patients that are above a certain percentage, it is recommended that they get checked a little bit more closely than just the yearly mammogram.
But again, you do not have to be high risk to come to this facility and be able to take advantage of the services.
Right.
Well, you know, one thing that we kind of teased there in the intro was talking about breast pain. So often I feel like we talk about lumps that women find, and that's such a sure sign. What about breast pain? Is that a sign of cancer?
Not usually.
Really?
Most breast cancers aren't actually painful. A lot of breast pain is from really silly things. It's usually some sort of nerve irritation, and it's usually stemming from something in the back. So a lot of people have back problems that kind of migrate forward to the breast and cause breast pain. So a lot of breast pain can be dealt with really easily. Things like heat and anti-inflammatories, sometimes doing like a trigger point injection, almost like people get cortisone injections in the knee for knee arthritis. We do them in the back to help the breast pain in the front.
Interesting.
Breast pain can be from breast cancer, but the chances of that are really, really unlikely. And it would have to be a breast cancer that had gotten so large that it's actually compressing on a nerve, causing that pain. And almost always that's picked up on imaging.
And I'm sure you get this question often, but I can't, of course, not talk about this when we are talking about breast cancer. When should women start with the mammograms, and how regularly?
So guidelines say between 40 and 45. I always say, why not start early? You know, so starting at 40 is always what I tell my patients. And definitely doing a yearly mammogram. So patients need to get their mammograms every year. Even if their mammogram was completely normal one year, that doesn't mean the following year that something can't pop up. So always recommended to do it every year.
Well, as a woman, I appreciate that one facility is dedicated to breast health, which is so important. Thank you for joining us today.
Thank you for having me.
And if you want more information on how Women's Care Florida can help you, or possibly even Carrie Swindle herself, there's the phone number and website for you to get more information.
Unique.